My name is Tom Gardner. I'm an ophthalmologist, particularly specialized in diseases and surgery of the retina in the back of the eye. And my particular area of emphasis is diabetic retinopathy, the way diabetes affects the retina. Well, diabetic retinopathy is one of the leading causes of blindness. So many of my patients have it or are at risk of having it. And the treatments, the diagnosis and treatment of diabetic retinopathy has improved substantially over the course of the last 30 years. Now, if people are diagnosed early and receive treatment early, and if they generally take care of their diabetes and associated problems, they have a very, very good chance of maintaining good vision. So that's all really good. Laser, for example, we know by just having an eye exam or having photographs of the eye that most diabetic eye disease can be diagnosed and treated. The treatment used to be exclusively laser treatment, which is destructive, and now we have the ability to put medications into the eye, and that is another very important tool that is not as destructive as laser. And but still, we use a combination of these tools as patients need it. The challenges going forward are is still to try to diagnose the problem and to be able to treat it early when vision is still intact. Yes, so there's a continuum. We know in general which patients are at risk for having problems by virtue of the duration of their diabetes, the degree of their control of their blood sugars, the degree of their blood pressure, or associated other diabetes problems such as a foot infection or having diabetic kidney disease. The effects of diabetes on vision. So most studies of diabetic retinopathy have focused on visual acuity, in other words, how people read an eye chart, and that's very important. But there are other aspects of vision, such as the ability to see at night, or to be able to see contrast, or to see colors, and different people with varying degrees of retinopathy have impairment of those aspects of vision. So vision is there are many different aspects of vision, and these other aspects are actually very important to people's quality of life. And so we actually have been particularly interested in the patients who have what's called proliferative retinopathy, and they are having laser treatment or injections, and so we've been studying the effects of that. We know that it's been known for a long time that laser treatment impairs night vision and side vision. And it's a particularly important question right now because as we try to recommend the best treatment for our patients, basically whether they get lasers or they have injections of drugs that block vascular endothelial growth factor. And so part of what we're talking about here is that depending on how one measures it, some aspects of the dark adaptation are reduced, but at least over the first year of follow-up, often for the most part their vision is preserved, pretty well preserved. So it's just further helping to provide information that physicians can use to recommend how their patients should be treated. Right. So one question that comes from this is there something that could be done to restore vision in people who have had a successful treatment, whether it's with lasers or injections? And so by understanding what the diabetes itself does and what the treatments do, we can can think on a cellular basis what the problem is, what is limiting vision, and then what might be done to restore it. So that part is still exploratory, but in this world where there's a lot of discussion about regenerative medicine and ophthalmology, it might provide an opportunity to enhance vision in ways that are beyond just the treatment of the retinopathy. It's very important for patients and their physicians to have an understanding that diabetic retinopathy is really one of the most preventable and treatable complications of diabetes. And while many people are understandably afraid of going to an eye doctor and finding out what they might have, it is still something that can be helped, and most people with appropriate treatment can live very long, healthy, productive, and enjoyable lives. And that's really what it's all about.